Welcome to this webinar on patient recall and reactivation secrets of high-performing practices. We're very excited to cover some great strategies that'll help you get patients back in for their regular care and reactivate those you haven't seen in a while. Now, the importance of this topic really can't be overstated. As we'll discuss, recalls and recare make up the core engine that drives your practice. So we want to make sure it's a well-oiled machine using the incredible tools you already have in PracticeWeb. So with that, I wanted to introduce myself. I'm your host today, Neil Kotari, the Chief Operating Officer of PracticeWeb. And I am going to navigate you through these strategies that we've put together. And I think they'll really be high impact for your practice. Now, I want to start out by identifying the backdoor problem of dentistry. And that's really the problem where you have patients that you've worked hard to earn their trust and their loyalty. And for one reason or another, some of them are leaving the back door of your practice. So you're working really hard to get new patients in the door. And we all know that that costs a lot of money and resources. And the patients you've already earned, they're, for one reason or another, leaving out the back door, and we want to prevent that. And a big part of that puzzle is the recalls and recare that these patients should be getting on a regular basis. So I want to also highlight the gravity and the size of this problem. It's really big. So the question I pose to you is patient attrition in your office costing you $8 million. Is it that big of a problem for your practice? And maybe you don't realize that. So let me give you a couple of statistics that bring that into a really kind of good picture for you. So in dental economics, there was a study done on the average annual loss of patients that leave that back door I was referring to, and it's somewhere around 17%. Now, if you're looking at a practice with 2,500 patients, active patients, that's like losing roughly 425 patients per year. Big problem. Now, that can result in an annual loss of more than $270,000 if you look at how much value each of those patients bring to your practice every year, and also how much treatment you could have been providing them, but now you can't because they left. So they lose out, you lose out. And now if you look across a lifetime of a practice, let's say you're running your practice for 30 years, that's more than $8 million. So this is the size of the problem that we are looking at today. Now, on the other side, hygiene is really your practice builder. This is what's going to be the engine, as I said earlier. So why is that? Well, on average, again, another dental economic study, 25 to 35% of production comes from hygiene, from the recare. And beyond that, another important thing to note is 80% of all production by a dentist providing treatment is originated from hygiene. So 80% of the treatment identified, the treatment planned is coming from the hygiene department. So those are some really important statistics. Now, if you look at a practice with 1.5 million in annual revenue, that translates to roughly 450,000 of just hygiene production, and then 840,000 of hygiene originated production, for a total of almost 1.3 million of that 1.5 million. So that's 86% of your production is one way or another influenced by hygiene. Now you can see why hygiene is your practice builder. So I want to give an example. We can't break down every single category of production on this, but I want to give one example to show this, and that's restorative production. So roughly 20% of hygiene recalls result in some sort of restorative production, restorative plan treatment. And so that's roughly $500 per patient. And in the study done by Practice Analytics, they found that $500 per patient is that restorative production from 20% of hygiene recalls. And if you extrapolate that for an average practice, that right there is total, even if you look at the whole year, it's about $36,000 in production. So that's just one sliver of the production originating from hygiene, right? So, and then if you look at the bigger number, it's roughly $1.3 million of that, and 86% of your annual revenue. So now if we go forward, I want to jump right into the 6 strategies that we have to really do a great job when it comes to patient recall and reactivation. We have the $8 million problem that we've identified of losing patients, patient attrition. We identified that 86% of your production is somehow related to hygiene. And then we took a sliver of that and looked at an example of restorative. So we want to capitalize on those opportunities and provide the treatment to patients that they need. Hygiene, recare, regular care is essential to oral health. Now, oral health is essential to overall health of any human being. So we are also providing a great, I would say, primary service to patients by making sure that they come in for regular care. Now, the first strategy is creating a memorable experience and educating your patients. I want to point out the commonly used kind of analogy here, which is you can always attract more bees with honey than vinegar, right? So we want to attract patients to come back for their regular care with your equivalent of honey. We don't want to be, like I'm going to mention later on, a debt collector and chase people down and you know, have a really tough job of convincing patients who just don't want to come in to book an appointment, right? It's better to attract bees with honey. It's maybe it's tougher to kind of create that honey, develop it, but once you have it going, well-oiled machine, you don't have to work as hard on the back end to get people back in the chair. So here in a study done by Future Odontics, they identified a few big reasons why patients either come back for regular care or don't come back, right? This is a survey done of existing patients of dental practices and what makes them come back. So the quality of work that they get is paramount. Then an interesting point in this survey was when you make it very clear to your patients what treatment is actually required versus optional, that is well regarded by patients and they feel that you're honest and trustworthy. Another thing is a clean, modern office. That wins big points with patients and makes them want to come back. The dentist obviously has to be gentle and considerate of the patients, have a good chairside manner. The staff also should be incredibly friendly when they're checking in patients all the way to checkout. Payment options, having some consideration for payment, financial difficulties a patient might be having, that is very, very attractive to patients. And then finally, last but certainly not least, is a short wait time. So I'm going to dig into one of these. This is a whole nother topic for a whole nother webinar of all of these, the patient experience, and we will certainly do that. But today I just want to focus on one quickly, is the wait time. So as an example of what you can do, this is again going back to the patient experience. How can we attract patients with honey? Because it's much easier than vinegar. So we want an inviting wait room. This is a stereotypical wait room when someone thinks of their dentist's office or even their medical provider, the primary physician that they have. And it brings to mind this assembly line that I'm part of to get my treatment done in the dental office. And it's really not appealing. It's not something that when they think about that experience, they want to come back to again and again. Now, again, this is not the end all be all. It's not all about the waiting room, but this is one part of the puzzle. So imagine now, how do you feel about this waiting room? That feeling you have right now looking at this waiting room versus the previous one is exactly what I'm talking about. Patient experience is a feeling. When they want to decide whether they're going to come back to you for their recare, it's a feeling. They have many, many, many other dental options, other dentists they can go to. So it's really all about the experience. It's a feeling. So again, wait room should be inviting. It should be welcoming, almost like, hey, I'm going to go over to see a friend and I'm going to their home, and it feels very homey and also very comfortable for me. So it doesn't matter how you design the weight room as long as it's warm, welcoming, and inviting. And obviously being modern, having modern facilities, having, you know, the nice TV screens with something good playing, having comfortable seating, all of that is a big part of it. But it's certainly, there's a lot of creativity that you can apply to this. Now, part and parcel with weight room is wait time. You don't, even though you make it super inviting, you have a fireplace, it's nice, cozy, you don't want to have people waiting in there for longer than they need to. So I want to point out, there's a lot of literature out there on how to design the patient experience. One good one is Dental Practice Hero by Dr. Paul Etchison, and he talks about the importance of wait time. So it makes some very good points. So number one, when the patient is engaged somehow in the waiting room, then that time that they're waiting is going to feel shorter. Everyone, since, you know, many, many decades, have been putting magazines and things like that out there on the table for patients to occupy themselves with. Great, you should have that, but you know, there's many other things you can do. Like I mentioned earlier, you can have something on the screen for them to watch. You can have other entertainment devices, iPads. I've seen stations where they have individual iPads that different people can use. Very effective for pediatric practice as well. And you can do a lot more with, you know, even pediatric practices. But somehow keeping patients engaged during their wait time will make that time feel shorter, even though it's the same amount of time. Also, I mean, obviously, no one loves to do paperwork, but paperwork does keep people somewhat engaged. They feel like they're moving one step forward in the process. But that also could clog up your workflow. So I recommend using mobile forms and trying to get all the forms done before the patient walks in. So find even better ways to keep them engaged if you can, because that'll make the time feel shorter. Another thing is patients want to get started. As I mentioned about the forms, it feels like you're moving forward in the process, but getting them in the operatory and you know, getting vital signs taken or getting some preliminary stuff done in the operatory will make them feel like now I've moved forward in the process and it's not much longer before I see the doctor. So it's a psychological effect of that. Some things that you want to avoid or try to prevent is make sure the wait time, there's some certainty behind it. If you can give them any, proactively tell them what to expect, then those waits are going to feel shorter. But if they don't know, it feels longer. They don't know what's going to happen, when they're going to be called. And if it's not explained why there's a wait time today, that also makes things feel longer. So try to prevent that with the front office flow you have when patients check in. Anxious, if the patient's anxious, then it's going to feel longer. So you want to relieve their anxiety. Again, that goes back to the waiting room experience and putting them at ease. Having the right demeanor and saying the right things when they check in can really reduce anxiety. And if, you know, we've all experienced this, when someone comes after us and they get taken in earlier than us, then we feel really, really frustrated about that. So try to avoid that scenario. There might be a good reason why that happens, but try to be equitable as far as you can with wait times. And last thing I want to point out here is that PracticeWeb does have a customer report to track your wait time. And in PracticeWeb, most of you might be doing this, but you want to definitely use the features to kind of check in the patient in the appointment schedule. And you right click on that appointment, check them in, or you can use the quick action buttons to check them in. And that will get them on the waiting room list that's in PracticeWeb in the bottom right corner of the appointment schedule. Now those wait times can be tracked with this custom report. It's linked down below in the description. And if you need any help implementing that report, please do let us know. Call us on support and we'll help you get that. But you do want to track that as one of your KPIs, your key performance indicators of the practice. Big part of your patient experience. And you need to know where you stand with that. But the starting point for that is making sure your team is using PracticeWeb effectively on the appointment schedule to check patients in so that it's getting the accurate times there. Now, another point I want to make about the patient experience and just educating patients in general is use the perio chart in PracticeWeb to do full mouth probes, and that helps you educate patients. Frequently, this is not done at certain practices, so you want to make sure you do that. Now we have voice perio feature, which there's a separate video on that, separate tutorial. Check it out. It's a great feature. You don't have to have extra help to get the measurements recorded, so that makes it more likely to get this done every time. You can copy and duplicate previous perio exam and build off of that. You can use the triplets feature to move quickly through the teeth, and then you can also use the graphical tooth chart in the perio section to educate the patient. So that's going to look something like this, and this will really be effective when you're showing the patient the health of their teeth, and you can compare it with previous exams if you'd like. Now this is very effective for education, and will all build into the probability that they're going to keep coming back to you for care, and they understand their the oral health that they have. Now, after you've done all this stuff on patient experience, and there's so much you can do, as I've only touched, it's only the tip of the iceberg, but once you've done that, you want to check, is it working? Is what I'm doing, putting all this time and energy in as a practice, as an office manager, as a dentist owner, as a front office team, is it working? So that's where you go to reviews, and again, I think most of you are checking reviews, but if not, you definitely should have a Facebook profile, a Yelp profile, a Google profile, and make sure you're sending people there after their appointments to get feedback. Now, this is an example from a real office. I've hidden the name and everything, but it's a real office on Facebook, and they actually have a decent rating, 4.7 out of 5. But you can see that they're gonna, even that kind of practice is gonna have, let's call it constructive feedback. Where are the problems? Where are the gaps in our process? Where are we not giving that great patient experience? So this person wasn't too happy about the office manager and the lack of concern apparently shown by the office manager. So you may have to have a conversation with your team about what happened here, and if there's anything we need to do to fix that. Even looking at good reviews is very useful, because you can see what's working, what's being noticed by patients, right? What are they picking up on, and really push harder on those things because it's working, right? In this case, this person pointed out the demeanor of the staff and the doctor. It's being noticed. The office environment, as we talked about earlier, this person said it was tasteful decor, impeccably sterile. So look, people are picking up on that. Keep making sure that that's getting done, updated as you need to. Now in Practice Web, you can use PW reviews, which automatically sends out review requests to patients after every appointment. And it doesn't have to be every appointment. You can modify that, but generally speaking, you know, it's every few appointments they come in, they can get an automatic review request, and then you can track all of your scores and feedback right within Practice Web. And I do want to point out here that there's a happiness rating you can see, and you can see it over time and see if it's getting better or worse. So if you're making some changes, maybe you did change your waiting room, maybe you did improve the wait time. Is it working? Do you see an upward trend in your happiness rating? This is great stuff. This is a high-level overview of what's happening on the happiness side. And then you can check on the ground level on each review what people are saying. Again, taking notes on what people are liking, not liking about your practice, right? So this can be done through Practice Web, fully integrated using PW reviews. Now that is strategy number 1. Really work on that patient experience. You can attract more bees with honey than vinegar. Now, if you've done all of that, great experience. They will recommend you to all their friends. They can't wait to get back. Awesome. Now, that's not enough. It's a big part of the battle, but it's not enough. You have to make sure that you schedule recalls during walkout without fail. At least try your level best to do that. And you may think that you're doing that, but the statistics show on average practices are not doing this every time. So these are some statistics from Dental Intel, taken from thousands of dental practices. The bottom 10%, they find 57% of patients walking out from today's recall are getting their next recall scheduled. So that means around 43% of patients are walking out without their next appointment scheduled. And there's really no excuse for that unless you get severe pushback. And I'll tell you why. I'll show you why in a moment, how easy it is. But there's really not an excuse for that. So this is the beginning of the problem here, right? On average, it's about 80% are getting scheduled during walkout, and the best of the best do around 91%. So that should be our goal. That other 9%, maybe you get severe pushback, they just don't want to do it, and you have to give into that. So these are the statistics with next recall scheduled during walkout. Now, I want to emphasize here, you know better than I that teeth are the only part of the body that can't repair themselves. This is why you need that regular care, and this is the type of education we need to provide to patients when they give that pushback to get their next recall scheduled. Now, how do we do this? So number one, your team has to believe that it's important to get the next hygiene recall scheduled. Your passion makes your patient more willing to schedule. It's really a transferring emotion, right? If they seem you're really enthusiastic about it, okay, there's something behind this. Let's get it done. Maybe I'll have to change it later, but this person thinks it's super important, so I don't want to say no, right? That passion makes a big difference. You got to reappoint during walkout, not just after the fact or try to track them down later, because people get busy and they get away. And for the patient, scheduling is making a commitment. They're at least getting on the calendar. So next time, maybe 6 months out, 5 months out, you're following up with them, they know they've made a commitment. They're going to at least respond to you or reschedule if they need to, right? So that's going to be much more effective than if you just said, okay, we'll follow up later, because then they might just ignore your calls and your contact. And you got to really anticipate the pushback, because despite what we might like to think, and maybe we've changed this emotion with the patient experience, but usually it's not their favorite place to visit, right? So there's going to be some pushback some of the time. Now, we just have to be prepared for that. So a quick kind of a strategy here, and you may have a great protocol, and if it's working for you, follow that. But here's some simple strategies I want to point out. Don't ask if they want to schedule when they're walking out, but ask when. So you want to say something like, so before you leave, let's get your next cleaning and exam scheduled. So it's kind of a foregone conclusion that you're going to get it scheduled. We just need to know, does the same day and time work for you in 6 months? Make it like a quick process, 1, 2, 3. So they really don't have too much time to hesitate, and you're just getting them on the calendar. You just want them to make that commitment, right? Again, it's for their own good. If they give you the pushback, I don't know what my schedule is right now. Oh, can I just call you later? I'm in a rush. Okay, let me make this really quick for you. I think we should make our best guess here what's going to work, because our schedule does fill up. Here's the date and time I have. It's very similar to today. Can we just get that on the calendar? And usually they're going to say yes. But you need to be a little bit persistent and a little bit strategic on this. Now, that is strategy number 2. Get patients scheduled during walkout, right? Get their next recall on the books. Then once you've done that, 6 months out, right? Oh no, so things are going to come up without a doubt. And this is a challenge that every practice faces with having patients show up for the appointments they've made, right? So you want to remind patients and confirm recalls. The question is, where are your patients going to be in 6 months? They could be, relaxing on the beaches of Hawaii for all we know, right? They might have completely forgotten that they made that commitment. And so if we don't have a great strategy, not just a kind of sort of strategy, but a great strategy for reminders and confirmations, we're going to pay for it. And pay for it we do. There's, on average, in a dental economics study, they found that 10% is the cancellation rate for any type of dental appointment. And if you're looking at hygiene only, that's a huge loss for the year. And then you have a lifetime loss if you extrapolate that of $3 million just from cancellations, right? So we want to avoid that. Now, what is that Iron-Clad reminder and confirmation process that we can use? So this is one example. Again, if you have your own protocol that's been working wonders for you, stick with that. But one suggested protocol is right when you schedule that with them during walkout, then you give them some sort of save the date reminder. Traditionally, this has been a business card where you write the date and time of the recall. We know that business card might fall through the cracks of their seats in the car as they're driving home, and they'll never look at it again. Or they might keep it. We don't know. But there's a more effective strategy than that. I'm going to show it to you in a moment. But do something to get them to save the date. Then 4 weeks before, you can give them some sort of initial reminder. And then 7 days before, do a confirmation. Make sure they confirm that, yes, I'm showing up. And then 1 day before final reminder, it's kind of a last minute 24-hour type of thing. Red alert, you know, if something popped up, then they can at least give you some notice that you can you know, work with. So this is the timeline that we suggest. One thing I want to say about confirmation, some folks do it very close to the appointment, like the day before, or some do it way far out, like 2 weeks before. Confirmation has to be a good balance. It's going to be different for every practice. You got to go with what's working for your practice, but you don't want to do it too far out, because that confirmation doesn't mean much if it's so far out, since things can come up in between that date and the appointment. And if you do it too close, it doesn't give you a lot of time to react if they say, no, I can't make it anymore. So you want to have that balance. Now, use a strategic reminder approach. So what I mean by that, you want to use multiple forms of communication. In 2021, that's absolutely necessary. And going forward, it's going to be even more essential. So phone, email, maybe lead with that if you're doing, when you're doing reminders, and then whoever's not confirming, follow up with a phone call, right? Use your time wisely when it comes to staff time, because we know that they're very busy and we don't want them to do things that can be handled through text and email, right? The initial reminders, initial stuff. This is our lives on phones, right? So before we go to sleep, we're checking emails, we're texting folks, we're browsing the internet, watching something on YouTube, like this webinar. This is our lives on phones. So this is where you're going to reach your patients. Believe it or not, the best way to get to your patients is through texting. So the statistics really back that up. 95% of texts are responded to within 3 minutes, which is tremendous response rate. That's in a study, a very big study done in Forbes magazine, and in a Pew survey and a Small Biz Daily report. So a couple different surveys done, they found that 96% of American adults use texting, and they're on their phones for almost 3 hours a day. That's incredible, right? And if you look at your own experience, you may not realize it, but now there's actually apps out there that track how much time you're using on your phones. You should check it out one day and you'll be surprised how much time you're using on your phones. So this is the reality. This is why patients are very responsive to texting. And so looking back at that timeline that I was showing you regarding the Iron-Clad reminder and confirmation process, here's how it translates for texting. With PracticeWeb, as soon as you schedule the appointment, you can immediately, automatically send a save the date reminder, or you can do it as a manual process if you'd like to, but it can be done automatically through our service. Then 4 weeks before, and you can customize these timeframes to your liking, but 4 weeks before, for example, you can send an initial reminder automatically. Then 7 days before confirmation, 1 day before final reminder, all automated. Now, if you automate it, this is gonna get done, right? If you automate it, it's gonna get done. And what does that look like? So these are just some examples of the text messages that go out. Even with the confirmation text, you can in fact include any form, like a COVID-19 form right now, or any other form you'd like them to complete before the appointment. And that's a great approach there. And another thing is that when they confirm, they're gonna immediately automatically update your schedule. So right there, you can see the confirmation bubble. It'll turn to green or whatever color you've assigned for confirmation if they reply with certain key terms that are listed above. So very good, very efficient, because now you can look on your schedule, who's confirmed, who's not. Now, that's why I said, then you go with the phone calls, start making some calls on whoever hasn't confirmed, right? Very efficient. Now, another great thing is that when they reply to those text messages, you will get those right within PracticeWeb here, and you'll see a text alert at the top of your PracticeWeb screen. And then over here on this screen, you'll see a two-way texting that you can do with your patients. And now we've even added emojis there. We've added attachment support. So you can do a lot with our two-way texting, but essentially get that rescheduled in a very efficient process. They don't really want to talk to you if they can handle it through texting, because they can do texting when they're doing something else, right? they might be multitasking, getting this taken care of. So much more efficient for the patient, more efficient for you. You don't have to chase them down, call them. So I think it's very clear that this two-way texting is another reason why you want to use texting as your confirmation and reminder strategy for recalls. Now, strategy number 4 is effectively follow up with those past due patients. So you tried to schedule them during walkout, didn't get done. They never called you back. Surprise, surprise. Now you want to follow up with those past due patients and make sure that they don't get too far out there where now it becomes a whole reactivation issue. So what are the statistics here? What is kind of the percentage of patients with their next hygiene recall scheduled, not just during walkout, but maybe you got them scheduled later, a little bit after the last recall, right? So bottom 10% of practices, your active patients with next hygiene recall scheduled is only 31%. That is horrendous. This is again from that dental intel study from last year. And now the average is still only 54%. So 46% of your active patients are not scheduled for the next recall. And even the best of the best, there's still a 30% gap. So this is why I'm saying that there's a lot of work to be done here, even if you think you're doing great. Now, how do we know how we're doing, right? You want to know the data. So again, click the link in the description below. There's a custom report there. We have instructions on how to set this up in practice. So if you want to use it, you can also contact us on support for help. But this is a custom report you can create in Practice Web, and then you have it there forever. You can use it. And it's going to show you patients with future recall scheduled, which I just talked about. And this practice is doing really, really bad. So I want to show just a bad example. You see how many active patients they have and how many of those active patients have a future recall scheduled, right? A lot of work to be done there, but hopefully you look a lot better than this. I'm sure you do, but there's still going to be work to be done. So you need to know where you're standing right now, and then you can develop systems based on the strategies that we're showing you to really improve this. Now, the other thing is you want to see the missing recall. So with the patient dashboard, which is included in version 19.2 and higher, you do have this patient dashboard, which you can have always showing on certain computers. Let's say the front office should at least be looking at this. You can have that, and any selected patient you're working on, you can customize this entire dashboard however you'd like, focus on certain things versus others. And one of those things should be the recall. When were they due? Are they scheduled or not? So that's going to immediately, if you're working on that patient for something else, let's say you're resolving a balance or they had a question, you're following up with them, maybe they have some planned treatment you're following up on, at least you'll see this too and make sure that you bring this up with the patient when you are already talking to them, right? So patient dashboard will help you see the missing recall. The other way this can get done, a very, very nice, effective way, is through Smart Caller ID. Anytime you call out to a patient who's in your practice, or they call in, this dashboard will pop up automatically, and it'll show you the missing recall, and it'll also show you if they're a cash patient, or maybe they have insurance benefits that will cover that recall. And that's something you should mention to the patient. Look, you have benefits to cover this. Let's get you on the schedule. Why leave that insurance money on the table? I know you're paying, enormous premiums for that dental insurance, and you're paying money. So why not get that recall taken care of, right, before your benefits reset? So you can say these kind of things because you see it right in front of you when you're talking to your patients. And this dashboard can also be pulled up on demand, kind of like the patient dashboard, by clicking a button in Practice Web. So very, very effective tool as well, called Smart Caller ID. Now, check recalls and be proactive. What do I mean by that? Recall follow-up, it's tedious. It's not a fun thing to do for most people. So it gets placed on the back burner until you have gaps in the schedule. That's when you go back and try to backfill, right? And that's not a good strategy. That's not being proactive. Instead, you need a regular process to check recalls. And this is different than reactivation. Reactivation is when folks have fallen through the cracks, or they just have refused your attempts to get them in, and you want to reactivate those patients. And we'll talk about that too. But this is to get folks before they fall through the cracks, right? So how do we do this? What is the actual strategy? I would say that check at least once a week. Check that recall list, which I'm going to point out. And this can maybe take a few hours at a time, depends how your list looks. But do this once a week, and it's going to be very productive for you. Look back 30 days, look forward 30 days, and figure out what needs to be addressed. If you do it regularly, you don't need to look back farther than that, because because it's every week, you'll be taking care of people, and anyone who is not able to get scheduled, that might be a reactivation issue at that point. So unless you're doing a reactivation campaign or filling gaps, and you want to look back further, you don't really need to go outside of this date range. You can, if it's working for you, looking maybe 60 days back, 60 days forward, fine, go for it. But this is what we suggest. In the recall list, you should set defaults so that your preferred date range, like the 30 days back, 30 days forward, that's automatically there when you open your recall list. So you don't have to even click any buttons to get there. And what is going to be your hold time or your wait time between follow-ups? Like when maybe you remind them today and then you hold for like 2 weeks and you remind them again. What is that going to be? So that can be also pre-selected as a default in your recall list. Here's how. So go to setup, appointments, and then recall. At the bottom of that screen, there's a section. And if you see that arrow there, it's going to show the date range, right? I want to look back 30 days and forward 30 days every time I go into my recall list. Default. Don't have to click any buttons. Next is the interval. So how long do I want to wait between reminders? Reminders in this case means outreach effort. So, I don't want to see them on my recall list if I already reminded them, contacted them, let's say 5 days ago, right? You don't want all that clutter there. You want to have a very focused approach so that even though you're spending maybe a few hours a week on this, you are focusing on the people that need to be contacted at that time, right? So you can set these reminder intervals for however you'd like, but one example would be, I reminded someone today, I don't want to see them on the list again for 15 days. I reminded someone twice or 3 times or more, I don't want to see them again on the list for 30 days, right? And then once I've reminded them 3 times, look, they're not maybe really interested. Let's focus on folks who haven't been contacted 3 times already. So then they will fall off the list. Again, you can tweak this however you'd like, but definitely set those defaults for your recall list. Then let's use the list. So you go to the list section of PracticeWeb. In the latest version, it's at the top. In older versions, it's above the calendar on the right side. But use the recall list for proper follow-up. That date range is what I was referring to. So that's going to be automatically set to your default date range. You can modify it as needed. And then here you can use the set status feature to set kind of highlight anyone you're working on in this list, and then you can immediately set the status. And those are all customizable statuses from the definition screen in PracticeWeb. So you can set the status there and keep moving, right? You see how that was done for this patient, Ryan. And down here, you have a lot of different options. If you want to email anyone, text them. If you want to get them scheduled, maybe they're ready to go, you can quickly get them scheduled from the recall list onto your appointments module. And you can also even do postcards if you'd like. So a lot of options down there. Now, if you did follow up and you do want to take notes, because next time you follow up, that's going to really help you remember the status. No one's going to remember what happened last time I talked to Ryan and why he didn't get scheduled. You put a quick note, it'll take you about 15 seconds, write it out, and then next time you can see that note. So in this case, this example, Ryan's out of country for 3 months. He's maybe touring the world, and he said, yes, you can call me back in 4 months when I get back. I'm sure I'd want to get back in at that time. So this will be great for record keeping next time you follow up with Ryan. And this will automatically pop up. And if it's not, let us know. We can make sure it's popping up. But it should automatically pop up anytime you update the status of a recall patient. I'm going to transition into how to follow up with patients, because this is something where I see a lot of room for improvement. One thing is, in PracticeWeb, there's a section in the clinical chart underneath the to chart where it's not really meant for any treatment notes there, because that can be erased, that can be overwritten. Treatment notes and treatment planning should be done in the progress notes section, to kind of the right of that red arrow there, the progress notes section. and when you treatment plan a procedure. Instead, this section is perfect for personal notes. So I give an example here. I'm in Phoenix, so I'm going to point out that the Suns are doing well in the playoffs. Hopefully they continue to do well. But let's say Ryan is in Phoenix. He loves basketball. The Phoenix Suns are doing well in the playoffs. Hopefully it goes well, and then later you can, bring that up when you're following up with him about, oh, wow, the Suns, did this amazing performance. They went far. He also, in this case, in this example, he has a golden retriever that he adores. Favorite hobbies are biking and hiking. He's looking forward to the weather improving. So this is just all coming from small talk. Record that. This is awesome, awesome material. And it just helps you build a relationship when you call them for your recalls, right? You want to connect emotionally, right? And I'm going to show you an example of that. But you have so much right here, so much material that you can use to now strike up a conversation with Ryan before you get into business, right? Before you get to business on those calls. So, and actually you can even use that stuff by texting the patient and just, you can do a lot of great things with those notes, not just recall calls. But what to say, so do your homework, that's part of it. The goal is to really get the patient on the line, not just leave a bunch of messages. So once you get them on the line, this is where you can plug in that personal stuff. So long time, how is or are blank, right? How was, how did you feel about those Suns? They went pretty far in the playoffs. How's Sam doing? He was really growing quick last time we saw you. How the weather's getting nicer now. Have you been able to get out there to hike and bike like we talked about last time, right? Perfect opener. It's a great way. It's fun for you to connect with your patients, build that emotional relationship. Then you get into business, and you have to be effective there. So, so John, I was calling because it's time for your dental hygiene visit. It's really important. Yeah, I know 6 months, it's just went by so quick. It's really incredible. So we are starting to fill up, and that's why I was calling you today. I didn't want you to have to wait to get in. I know you're really regular with your care. We weren't able to get that scheduled last time, but we can take care of that right now. And I have this slot ready for you because last time you came in around this time on this day. So I figured out this might be a good slot for you. It's about, a month out from now. How do you feel about that? Does that work for you? This is an amazing way to go in, having done your homework and very strategic, right? So this is an example that you can use. Now, one thing I want to emphasize again is don't sound like a debt collector. No one wants to be picking up the call from the dental office if they're going to sort of shame them about not coming in, right? That's not a fun conversation. Make it a pleasant conversation. So don't shame your patients. Don't use the word due. I really don't like that word. You're due for this, you're due for that. It's going back to that debt collector. You can really avoid that, right? When I showed you in the previous example, it's time for your important dental hygiene visit, and we're starting to fill up. Let's get you on the books. Let's get you on the calendar. So you can educate them on the importance of regular care. Give them an analogy if it works. Like, for example, it's just like maintaining your car, so you can avoid switching out your transmission later, right? Let's make sure it's preventative instead of reactive. If they say, let me think about it, get back to you, at least get a verbal commitment. That's really getting the next step solidified. Okay, John, how about I call you back on Friday, and by that time you'll have looked at your calendar and we can agree, on what works for you. Perfect, great. So that you put that in your notes in the recall list, you know that he made a commitment, and you bring that up next time you call. So that's how you get them scheduled. And so another thing I want to say here with recalls past due is make hard things easy so they get done. Again, make hard things easy so they get done for your dental practice. So if you make it easy for your team, it's going to get done. If it's hard, it's complicated, it's less likely to get done. So what's easier than automation? Nothing, right? That's like the peak of ease because you don't have to even do anything. So one thing where we can really help you with recalls past due is automatically text those patients for their recalls. And this is great. You can modify the message to your liking. You can put some emojis in there. You can make it fun, but automatically text your patients that are past due for recall. Now, consistent with what I said earlier, you can decide from our PW Connect texting service what is that date range, right? What is the time period you want to look at automatically where this is the people that should be getting contacted by the automatic texts. And these reminders are sent once a week. So every week, like we have recommended you to do even manually, but once a week, it's going to be checking automatically who's due for recall in the last 30 days and the next 30 days. For example, you can modify this to your liking, but that's one aspect of this. And then how many reminders should they get? We don't want to annoy our patients. Maybe they just don't want to come in, but you don't want to lose them forever by annoying them. So you can set a max reminders and how often it kind of recycles, right? So this is a great way to customize that. And one more thing I want to point out with this is you can, if you're using our online scheduling service, which is amazing, you can include the link to your online scheduling portal in your recall reminders. Now that's a 1-2 punch. You're automatically reminding them for their recall, and they can just tap on their phone on that link, which is, it's going to be tappable, so you can just tap on it. It'll open up your real-time schedule. They can find their own date and time and get that scheduled. That is amazing, right? That's going to really increase your recalls, and we've seen that happen for our clients. So that's a 1-2 punch that you can include with the automated recall reminders. Now, additional hygiene visits, we have actually surveyed our clients using this, and it's up to 90 additional recalls scheduled per month. That is incredible. So you're getting so many more recalls scheduled per month just from automated recall reminders. Now, strategy number 5, the 5th strategy here is to win back and reactivate lost patients. They're not a lost cause, they're just lost patients. So we want to win them back. How do we do this, right? These are folks who, they're outside of that date range of 30 days prior, 30 days forward, and we just want to get them back. So first you got to find them. So I would say run a reactivation campaign at least once a month to get patients back in for their regular care. And the ideal look back period is 18 months. If you do this once a month, you're not going to have to really go back to 2 years, 3 years, 5 years. You might have to do it if you're just starting it out regularly. But again, if 2 years is working for you, 3 years is working for you, do it. But ideally, 18 months is all you'll need. Because again, your return on investment. So the investment here is the time, energy, your resources to follow up with these people, with these patients. That's going to drop off after 18 months because they might have moved, they might have changed dentists, they may not, no matter what you say, they might not care about regular dental, hygiene visits, and so there's this type of people that wait until their tooth starts aching. So 18 months might be where it kind of drops off after that. So reactivation is fishing. That's the best analogy you can think of. It's fishing. So you're throwing out the line, you don't know who's gonna take the bait, but you gotta throw out the line, otherwise you're not gonna get anything, right? So that's the reactivation process. So you gotta be patient and you have to be persistent. How do we do this? So how do we do the reactivation? Use a multi-pronged approach: calls, emails, texts. Postcards and mailers, I know practices do this. It traditionally was a very popular method. Again, because of what I said about our lives on phones and even on emails, those are going to be more effective, but you never know. Sometimes it might today, because I don't think it's necessarily the case if I look at my own mailbox, but some people say that because people are mailing less now, when you do mail, it's going to be more effective, but I don't know. I mean, I still put my bet on calls, emails, and texts, but you can definitely, if postcards are working for you, if there's some proven data behind it, go for it. I would lead with texts and emails because, again, you want to be efficient. That'll identify interest and save your time, because then they're going to reply, right? If they reply, you can focus on those patients. Then follow up with calls to the interested patients, or maybe for whatever reason the text and emails didn't work enough for you. Now you got to go in with the calls and try to generate more interest. So the recall list is headquarters for this, right? So set that date range for the last 18 months, if that's what you're going to use, or the 2 years or 3 years. And then down at the bottom, again, you have all these options to reach out to patients. And one great option is the text option, because with texting, you can click that button and anyone with the mobile phone number in your database will get a text message, unless they've said they don't want text from you, right? If you've put that, then they won't get it, but otherwise they will get it. You can modify this message however you like. Again, you can put an online scheduling link in here, but make it exciting, make it fun, make it compelling. But you can text all of those patients with a single click. Boom, you're done. Now you wait, and you're going to definitely start getting two-way text back. You're going to start getting alerts in your practice web at the top. That's who you focus on. At least get them on the schedule. Very, very productive approach. That's the send button. So what to say? So let's say you do need to talk to someone about this. Maybe you've gotten some through texting, but you have to call others. Again, check that clinical chart, the general notes area, if you're using that effectively, and strike up a conversation. Always try to strike up a conversation. It doesn't have to be a 10-minute conversation. You got things to do. 2 to 3 minutes. Check in. How are things going with this, with that? And then you tell them how long it's been. Whoa, it's been that long? I didn't realize that, right? Sometimes they don't realize. If you just say it's time, they're not going to know how long it's been. So if it's been, wow, it's been 18 months. Yeah, I should probably get back in. I might have some issues that need to get checked out. And then give them a little taste of patient education there. Why it's important, because you know these are people who are dragging their feet, right? Not putting enough importance on it. So be ready with a punchline of why they should get in. I put an example here of, just pretty basic, but you can have even a better one than that if you can think of it. And then again, have that slot ready to go before you call. What do they like? Look at their previous history in Practice Web and get that slot ready to go. If it doesn't work, you can switch it up, but it's always better to have something in hand to offer than nothing at all. So if you're going to leave voicemails, you should generate curiosity. Don't give away the whole game in your voicemail. So not this. Hi, John, this is Sally from Dr. Smith's office calling about your hygiene visit. You're supposed to have, and you're X months, let's say 18 months behind. Please call us for your cleaning at this number. You're giving away the whole game. We know that voicemails are generally not effective. They're generally ignored. Again, why texting is so much more effective, but voicemails do have their time and place. So you have to generate curiosity. So it's better to say something like, I'm calling about your appointment. Can you please call me back at this number? They'll be like, what appointment? Do I have an appointment scheduled? Is this something that I need to get scheduled? I already have it. What's going on here? I'm curious. I'm confused and curious. So you're definitely gonna get more response that way than the first approach. And again, we're dealing with patients who are difficult to get scheduled to begin with, right? That's why we're doing all this unique strategy. And then the last strategy, that's talking about reactivation. Very, very important to have it as a regular process in your office. The last strategy is kind of a catch-all. So if that's not working, you're gonna have to dig deeper and do something more dramatic and kind of broader approach, right? This is providing dental specials and hygiene education. And this is called nurturing in the marketing business. You want to nurture those patients, meaning that they may not call you today to get that scheduled, but man, I've seen so many emails and text messages from this doctor about how important this is. Now's the time. Let me call them. I got to get in, right? It's a nurturing, and then it has that result after a while. So email newsletters, these are very good, and I would make it part of your process. From a study done by Patient News, email newsletters are going to create 70% more patient interest in your services than postcards or mailers. 70% more. They did a very wide-ranging study of dental practices, and they found these results of people actually responding, getting scheduled, etc. So email newsletters is the way to go for this type of marketing. And what do you do there? I mean, I would say here are some simple examples, but have your dental specials. Always lead with a special if you have one. Go for some education. Make it interesting. You can make it even better than what you're seeing here. You can make it very eye-popping and dramatic, but have some definitely education on there. They might click on that and read it. If people can binge watch shows on Netflix that have very little value to their life, once in a while they're going to read something. I should probably find out about gum disease it's time for me to know about this. They might, you never know. So you gotta include that. Office updates, if you have new providers in the office, new associate dentists, or maybe a great hygienist, you have changed your hours, you've improved your hours. Maybe you started on Saturdays now, or you expanded to evening hours, or you're doing early hours, whatever it is. Any office updates. Maybe you have, like we talked about, the waiting room. It used to look like picture number 1, now it looks like picture number 2. You want to show that in your newsletter, right? Office updates, get them excited. You want to excite them with these newsletters. Another way to excite them is through contests, through fun events. So that's just going to create engagement. We want engagement. Even if it doesn't result in an appointment right then and there, it will result in an appointment down the line. Get them engaged, get them interacting with your practice. Have contests running, have raffles, have fun events where you can just do like a hygiene education event or something, just have people come out, or some sort of party or something for your practice and the patients to say thank you for this year, or whatever, a summer event. So have that in your newsletter, right? Lot you can do here, and we can always give you more pointers on this. In Practice Web, lucky for you, you have email marketing built right in. So right there, you see a PW newsletter button at the top, and that will take all of your active patients, or if you want to include guarantors as well, that are not maybe patients, maybe parents of your patients, you can include them, create an email contact list, and then create the email campaign. So this is done with just a few clicks. This is so much easier than getting a list of emails from your Practice Web, exporting them, putting it into some other email service, and then having to do that every time. This is so easy, right? So this is done, and then once you can do a lot with this. Just a quick preview, you can have all sorts of templates designed. We have some sample templates that you can use ready to go out of the box in this service, but you can create your own, and they're there to reuse as much as you'd like. And I'm not going to go into everything right now, but we do have a great tutorial on how this service works, PW Newsletter. And you'll see there that you can even have analytics, who's opening your emails, who's engaging with your emails, who's clicking on things in your emails. Awesome, right? You can see how it's working with those analytics within our service. So that is a PW Newsletter. And then last thing I want to point out here is texting. So texting is actually more effective than calls or emails for short messages, and really great for marketing. Why is that? So what have studies found? Studies have found that you have a much higher response rate with texting versus calls, and we kind of talked about that earlier. If someone doesn't recognize your phone number, which is somewhat likely, if a lot of people don't save their dentist phone number right away in their phone. So if folks see an unrecognized number from a vendor of any kind, 97% of the time they're ignoring that phone call on purpose, deliberately, because they don't recognize it. And that's with the study done by ZipWhip. So this is why you're having problems on phone. And then also with email, I still think email is awesome, really great for newsletters, because with newsletters, you can actually include that's a great another point, that you can include a link to your newsletter in texting campaigns. So you could do a 1-2 punch with your newsletter service and your texting. Include a link in the text message to your newsletter and say, here's our newsletter, please check it out. They can click that link and see it on their phone, read it on their phone right away. But still, I think email, just traditional email newsletters are great. However, the response time is going to be much faster with texting. And the unfortunate part of emails, which, there's ways to avoid this, which we'll train you on in another webinar, but on average, 25% of them are read. The rest might go to spam, or they might be skipped over, whatever. And we all know this from our own experience. This is in a study done by HubSpot that does a lot of this marketing stuff. So texting is going to be effective. And what can you do there? With Practice Web texting, you can create multiple campaigns of any kind. So here in this section of the actual text templates, you can create as many campaigns as you'd like, as such, and you see here. And I'm gonna kind of talk about this campaign as an example. So this is like a Smiles for Spring. Right now you can do a Smiles for Summer special, and teeth whitening is always very effective to get people in the door. So if you want to kind of tie it to something usually, so tie it with an exam and cleaning. So if you get your recall scheduled, you'll get a free teeth whitening, and now you're ready for summer, right now is a great time to do this campaign because people are re-emerging into the public now. So they want to look their best, and this is a perfect time to do this kind of campaign. But create urgency. Say the first 100 patients can take advantage of this offer, so respond quickly. If you put that urgency, or maybe you put an expiration date behind it, it's going to create more response, right? Now you create that, and then in the texting service PW Connect, you can actually target certain insurance plans. If you know that certain insurance plans have better benefits, then you can target them, or you can send it to all your patients very easily, and then pick the template that you created, for that campaign. So that is going to be text marketing, very, very effective. I think with all of these strategies that we've discussed, you're ready to boost your recalls and reactivations. And everyone needs help. Everyone can use help. Reach out to our support team. That's what we're here for. We love hearing from you guys. We get very excited when we give you a nice strategy, and it works wonders. So call us or email us at, you can call us at 800-845-9379, option 2. You can do support@practice-web.com, or even easier than that, you can just click on remote support in your Practice Web under the help menu, and that'll take you right to our support page. You can drop us a line, and then we'll just get back to you, so you don't have to wait for us. Although right now, if you call, you're going to usually get a live person right away. But if you feel better about just dropping us a line and having us call you, you can do that. And there's also, you can reach us. If you forget about that, you can go through our support icon at the top of our website. But this is a great way to get in touch. And we do have some special offers expiring at the end of this month. So if you're watching this after the end of June, call us. Maybe we have some great specials running that you can take advantage of. Smart Caller ID, 30-day free trial. That's the one that I was mentioning about seeing your recalls. That's $149 a month. It comes with insurance verification as well. So you can in real time verify insurance benefits with a single click for your patients. There's a lot more features that I haven't covered on that. $149 is really worth it. That's 50% off, and you can try it out. So proof is in the pudding. Texting, that's 30-day free trial as well, $79 a month, really affordable. 50% off for a regular price. You save close to $1,000 on that offer. Email newsletters, $49 a month, also 50% off. And if you don't have support and you want, because to use any of these other smart tools, you need support, you need the latest version. And some of the tools we talked about, even in Practice Web, are in the latest version, other than these smart tools. So get back on with support with us, $99 a month. You'll save close to $400 a year on that offer. So great stuff there. Keep learning with us. We have a lot of events and blog articles and strategy articles for you. Look at our blog on our website, which is really great. And check out our Facebook page, our Twitter account, LinkedIn, this YouTube page. Definitely click to subscribe on the YouTube page. You'll get alerted anytime a new video comes out, and that's a great thing to do there. So like the video, subscribe below, and definitely get notified. Enable those notifications so you get a new video as soon as it's hot off the presses. Thank you very much, and we look forward to talking to you. If you want to, our sales team is also available, option 1, same number, sales@practice-web.com. You can also contact us from the website, but looking forward to talking to all of you guys. I hope this helps. Implement these 6 strategies. You'll see dramatic improvement in your $8 million problem, and you're going to really be able to capitalize on that 86% of your revenue and maximize that. Thank you very much, guys. Have a nice day. Goodbye.